Well, we're just about ready for the ending of this one, but I did want to think through with you a way maybe we could do a little bit of summary in here. So what I'd like to do is invite the people who were the chairs of the panels to come up here, as well as the people who were the chairs of the breakout groups in here. That would be great to have Belinda and Rick to come up, if you would, and Laurel as well, to give a minute or two of summary of where the groups have been today and what the next stages might look like in here. So, Ruth, maybe, do you want to start?
Well, first of all, I want to thank the IOM and IOM staff and the organizers and all the moderators, because it's just been an extraordinary workshop and meeting, and the quality of the discussion and the presentations have been amazing. So thanks, everyone. And again, from CDC's perspective, we're really looking to learn and garner all the brilliance that are from these multiple workshops and this whole forum to really start to inform us, how do we move towards prevention, and how do we do a better job in the prevention and health promotion of children's mental health. And so I always keep putting it back into that public health framework, and I go back to detect, respond, prevent. And what I keep learning is that even within each one of those fountains, if you will, while there's a lot of great innovation and work being done, there's also huge gaps, you know. And what I want to see come from the notes are more like, are there immediate things that we can be doing? And then are there midterm and long-term things? But I start thinking about what was said, and I think it was Harold who said it earlier, about accountability. Then who is accountable for doing those? And I think that that's still a big issue for prevention. So once we find out who those players are, that'll help us to do that better. A couple of other things that I heard is this whole concept of something being politically safe or sustainable throughout. But within that couch is this whole thing about having a much more educated electorate or a much more educated public. And by that is making that data much more accessible, whether it be for the families who are involved, who are partners in that process, whether it be for policymakers, whether it be for researchers. And then here, I think it's our responsibility. We need to be accountable on making that data, those tools and those resources much more accessible, not just in terms of being out on the web, but even in the language that we use. And so, again, in each one of those fountains of responding and prevention, seeing what role it is that we play and how we do that better. And then I think one last point is this, in terms of technology, but it goes back to data too, is that it is a changing world context, and we have emerging technologies and emerging information. And again, how do we make those much more accessible to folks who would be using it? And I'm very excited about the presentation earlier. You know, it's like their technologies are making some of these data, gathering data, sharing data, fidelity, feasibility, much more affordable. And that's been a huge barrier to why we don't do more evaluation. And so now maybe that's one thing that we've overcome. So thank you.
So I have many roles here, but I was the moderator of the second panel, which focused on measurement systems to assess individual and population level change. I'd begin with agreeing with Ruth that this has been an extraordinary day and a half with an extraordinary quality of presentations in many different areas. I think in the second panel we saw a series of examples of, at many different systems levels, real attempts to use systems to monitor data and indeed to measure outcomes. And I would agree with Ruth about one issue, which is this is really about accountability and about the measurement of outcomes. How do we take the science that we know and continues to evolve and apply it in ways that are going to improve outcomes for kids and families. And I would say across the panels, and certainly in the last panel, really attention to how systems work is really important. That was very much a theme. When we did our work, I think a second issue, which is where are one of the huge gaps? We did a lot of work with Head Start in developing a program about maternal depression, and we had a readiness scale that centers had to fill out about whether they were ready to begin to address parental mental health issues. And, we didn't work in centers that weren't ready. Well, and I think Marion was saying that they didn't work in centers that weren't ready as well. But if we're talking about population level impact, we need to eventually get to all centers. And we need to think about not just those that are ready or those that are ready to adopt, but how we frame the pre-contemplation period, as it's called from psychotherapy, or the period before engaging, to really have a population-level impact. And then I think the technology, I agree with Ruth very much, may offer significant cost savings and also significant standardization of certain ways of looking at things, which are things that have historically been quite costly to do. And again, I thank you all for your patience. I'm sorry, once again, we're in a room without the windows open because we all do better in natural light, but this has been a fantastic forum. Thank you.
Great. And when we had 3 wonderful breakout groups in here, Laurel, do you want to give a summary of your group? And key points.
Our group was focused on the individual level measurement aspects, and we went through what were the gaps in measurement and what were some of the obstacles to measurement and implementation, and then some of the solutions. And I have to say the group was really quite energetic and came up with a pretty robust list of interventions and things to think through. And I think coming out of that group, 2 themes that I felt emerged were looking at primary care as a mechanism for prevention more thoroughly, as well as looking at early intervention, Head Start, and universal preschool. All of those would be good locales for moving forward on improving prevention. The other thing I think which I've heard consistently over this meeting is how do we let vendors, health plans, etc., understand the importance of pediatric mental health when pediatrics gets short shrift for adult health care and pediatric mental health gets short shrift for mental health care. And in many ways we have the people who are committed to these areas in the room, but we may not have the people we need to be raising the consciousness of. So I think that was another issue that kind of has surfaced over the last 2 days, is the critical role of getting vendors and payers and others to understand how important this is and help us think through some of these issues around measurement and implementation.
Thank you. Rick, do you want to summarize a little bit from your group?
Sure, thanks. Again, it's been a very informative forum. A lot of wonderful papers, very insightful across the whole breadth of endeavor here. Our session was really focusing on the issue of how do you do measurement and what's going on in the community level. And in fact, David Chambers have asked, what's community? And that's a real worthwhile question. And we actually had a pretty spirited discussion around a somewhat abstract topic. And it comes down to, it depends on the circumstance. Most often it tends to be place defined, but a community may be a little town of 2,000 people, or it may be a large metropolitan area. Community may be the Native American reservation. It may be the LGBT community across the state. So community often varies, and programs have to be responsive to that. Our group ultimately came down to, as we were assessing gaps and opportunities, to the acknowledgement that a lot of data is already collected, and very few of us are really aware of what's out there. there's a lot that's collected. There's a lot that's available. There's a lot that's in the public domain. If you look into the private sector, the for-profit sector, your eyes would probably pop if you looked at, someone cited the Zillow housing sales website. The degree of contextual information, community level information that you can get there that actually plays quite importantly in these areas of cognitive, affective, and behavioral disorders. There's a lot there that's already available, that's aggregated, and so we need to be careful not to just reinvent the wheel in terms of data collection. We really need to understand what's out there. $800 assessments for fidelity are just not affordable. There's certainly, it's great to do it. It's critical to do it as you're developing it and validating it. But you can't make it more expensive to track fidelity than it is to deliver the intervention. And that really is the challenge, especially in the public sector. We've got to do things in an affordable way.
Thank you. Darrow, we had 2 wonderful sessions today. Do you want to summarize? Oh, Belinda, sorry. Excuse me.
It's okay. We had a third breakout group yesterday focusing on improving state-level measurement systems and system-level data to promote children's cognitive, affective, and behavioral health. And our group, we talked about a wide range of topics, but a lot of the issues that we talked about really focused around infrastructure needs across the state when you're talking about measurement of any kind of outcomes on children and adolescents. And we also talked about needing to do more coordination across state departments to really understand what kind of data collection is already going on, as well as how to maximize federal data that might be available that can allow a state to look within their state across the state all the way down to a community level, and really needing to try to maximize a lot of the resources that we already have. As well as there are some states that are doing a very good job of measuring CCAB-related outcomes on an ongoing basis, and really trying to understand where that's happening and to try to disseminate that information so that other states that want to take it on don't really have to start from scratch. They can build on work that's already going on. Those are just some of the things that we talked about.
Darrow?
Okay, so I guess one of the first kind of obvious, reaction to the panel that I did this morning is, this recognition that people across sectors are really struggling with a lot of the same issues. We were focused particularly on measurement of quality and quality improvement, but I would assume the same could be said for other things. And just thinking about ways to create more opportunities for that kind of crosstalk to kind of learn from each other. And I think might have been Harold, one of the speakers mentioned, these different sectors might be kind of on different developmental trajectories in terms of their thinking and implementing of these kinds of issues, but being able to learn, from each other, that's definitely one thing that stood out. I guess just 2 other things that I pulled from my panel that I think have maybe been hinted at, but could use some further discussion. I was really struck by kind of Rachel's comment and observation of this idea of using measures that might have been developed for one purpose for other purposes, and when that may or may not be appropriate, and really trying to think about that. And related to that, I think it was kind of mentioned in one of the questions yesterday, but this whole idea of particularly when we're talking about the children and youth population and how demographics are shifting over the next decades, and the implications that might have for our thinking about measurement and related issues. And the other thing that was, again, sort of, I think, hinted at in Kristen's presentation, and maybe a little in the others in my panel, is this kind of ongoing discussion / debate around evidence-based programs versus principles and practices. And I think that's something that we need to continue to have, more conversations about.
Thank you. And Eve?
So going back to the 2009 report, we have evidence-based interventions that are not being implemented in real-world settings. But we do have examples of systems and programs that are going to scale, and that has required the development of new measurements. And so our panel highlighted some of those measurements that have been developed, in which we're learning a great deal about implementation in communities, and we still need many more measures to look at how communities make decisions about implementing interventions, whether they're evidence-based or not, so that we can move forward in this process.
Thank you. And I have two last comments in here. One of those is that we will have this workshop available in printed form. It'll be available on the web, and ultimately will also be available in a book. I think those are really useful to capture all of this. We will also continue the work in here. So this is not ended. This is a start, and I think this is a next stage of collaboration in here. The last thing I wanted to do is really thank all of the people who had put all of the effort into putting together this meeting. The people here who are sitting up front in here were all on the planning committee, and we also had, I don't know all of the people, but probably another 6 or 8 people on the planning committee. So I really wanted to thank everybody on the planning committee first for all of their great work. The second thing is I wanted to thank all of the people who came here and gave presentations. This was really wonderful. We had some outstanding presentations in here. Thank you for all of your work in here for doing this.
And I would add to that the forum exists because we have sponsoring organizations, and we want to thank the sponsoring organizations. And I speak for Hendricks and myself. We want the forum to be responsive to the needs of the sponsoring organizations. We hope this forum will continue for a long time, but we certainly want to be responsive. I think Ruth's call to action, I might frame that as we need immediate action items, we need intermediate action items, and we need long-term action items. And we need to be thinking in each of these presentations and in each of these forums how those things come out. So with that, thank you very much. Good.